Most men don't talk about this. They notice it, they deal with it quietly, sometimes even laugh it off, but deep down they wonder why it keeps happening. You finish urinating, you think you're done, you zip up, you walk away, and then a few seconds later, a small leak appears. Just enough to be annoying, just enough to make you feel like you didn't fully finish. This is called post-void dribbling, and it's far more common than most people realize. As a urologist, I can tell you clearly, this is not about hygiene. It's not about being dirty, and it's not even necessarily a disease on its own. It is usually a mechanical issue, a flow issue, a muscle coordination issue, and once you understand how the system works, it becomes much less frustrating and much more fixable. Let's start from the beginning. When you urinate, your bladder acts like a muscular tank. It contracts, pushing urine down through a tube called the urethra. The urethra is not just a simple straight pipe. It passes through different anatomical regions, including the prostate in men, and then continues through the penile shaft. Now here's the important detail most men never think about. The urethra doesn't always fully empty itself immediately after urination. A small amount of urine can remain trapped in the portion of the urethra that runs through the pelvic floor muscles. Think of it like a small pocket, or a slight curve where fluid can linger even after the main flow has stopped. So when you stand up, adjust your clothing, or start walking, gravity and movement shift that remaining urine forward, and it leaks out. That is the dribble you notice. Now the next question is obvious. Why doesn't the body clear it properly in the first place? The answer usually comes down to one key system, the pelvic floor muscles. These muscles act like a sling at the base of the pelvis. They support the bladder and help control the release of urine. When functioning properly, they contract at the end of urination to squeeze the urethra and push out any remaining drops. But when these muscles are weak, uncoordinated, or not being used correctly, that final clearing doesn't happen efficiently. So urine remains behind. And this is where lifestyle and age begin to matter. Many men don't realize that pelvic floor strength is not automatic. It is not something you just have. It is something you maintain. Sitting for long hours, low physical activity, chronic constipation, obesity, and even poor breathing patterns can all weaken these muscles over time. Now let's talk about something that becomes more relevant with age, the prostate. As men get older, the prostate often enlarges naturally. This condition is known medically as benign prostatic hyperplasia. When the prostate grows, it can partially narrow the urethra. That means urine flow becomes less smooth. It may not empty as efficiently. And when emptying is incomplete, more residual urine remains behind in the urethral passage. That increases the likelihood of post-void dribbling. So in many men, especially after middle age, it is not just one cause. It is a combination: mild obstruction from the prostate, plus reduced pelvic floor efficiency, plus habitual rushing during urination. Now let's make this very practical. Most men urinate in a hurry. They finish, they immediately move on. But the urinary system does not work like a tap you just turn off instantly. It requires a final closure phase. If that phase is skipped, dribbling is almost guaranteed. There is also another factor that people underestimate: posture and relaxation. When a man is tense, holding his breath, or slightly straining during urination, the pelvic floor does not coordinate properly. The bladder empties under pressure, but the final squeeze mechanism doesn't activate correctly. That leads to residual urine in the urethra. Now let's pause on something important. This is not dangerous in most cases. Post-void dribbling alone is not usually a sign of serious disease, but it is a signal of function. It is your body showing you that something in the coordination system can be improved. And the good news is, it usually can be improved. One of the simplest and most effective techniques is something we often teach in urology clinics, even though it sounds almost too simple. After you finish urinating, instead of immediately pulling away, you gently engage the pelvic floor muscles. This is sometimes described as milking the urethra. In practical terms, one method is to gently press the area between the scrotum and the anus, the perineum, and move forward toward the base of the penis. This helps push out any remaining urine trapped in the urethral channel. It is simple but mechanically effective. Another very important intervention is training the pelvic floor itself through what are commonly called Kegel exercise. Now, Kegel exercises are often misunderstood. Many people think they are only for women or only related to sexual function. But in reality, they are fundamental for urinary control in men as well. The correct way to understand a Kegel is this. You are contracting the same muscles you would use if you were trying to stop urination midstream. But the key is not to actually do it while urinating regularly. That is only for identification. Training should be done separately. When done correctly and consistently, Kegels strengthen the pelvic floor sling. That means better control during urination, stronger closure at the end, and significantly less residual leakage. But consistency matters. This is not a one-day fix. This is a conditioning process. Like training a weak muscle in the gym, you need repetition over weeks. Now let's talk about timing. Many men improve symptoms simply by changing how they finish urinating. Instead of rushing away immediately, you pause for a few seconds after the flow stops. You remain relaxed. Then you gently contract the pelvic floor once or twice. This gives the system time to complete the emptying process. Some urologists call this delayed finish technique. Another useful method is double voiding. This means you urinate, wait a few moments, and try again. Often, a small second stream comes out. That second pass helps clear remaining urine from both bladder and urethra. Now, let's bring in another factor that contributes to this issue: lifestyle pressure. A lot of men drink large volumes of caffeine, especially coffee or energy drinks. Caffeine is a mild bladder stimulant. It increases urgency and can make bladder contractions more irregular. This does not directly cause dribbling, but it can contribute to rushed urination patterns and incomplete emptying. Hydration timing also matters. If someone holds urine for long periods and then rushes to empty quickly, the system behaves more forcefully but less precisely. There is also body weight. Increased abdominal pressure from excess weight can weaken pelvic floor control over time. This is why weight management is often indirectly beneficial for urinary symptoms. Now let's address something important from a medical perspective. If post-void dribbling is accompanied by other symptoms, it may point toward deeper issues. For example, a weak or interrupted urine stream, difficulty starting urination, frequent nighttime urination, a feeling of incomplete emptying, straining to pass urine. These symptoms together may suggest obstruction or bladder dysfunction, and in older men they can be associated with urinary retention or prostate enlargement conditions like BPH. In those cases, lifestyle changes alone may not be enough, and medical evaluation becomes important. But in a large number of men, especially younger and middle-aged men, post-void dribbling is primarily a functional issue. That means it responds very well to behavioral and muscle retraining. Now let's talk about something most men never hear in detail: the actual mechanics of the final phase of urination. When the bladder finishes contracting, the urethra does not automatically clear itself. It relies on a reflex contraction of the bulbocavernosus muscle, part of the pelvic floor group. This muscle essentially squeezes the urethra like a tube of toothpaste, pushing out residual fluid. If that reflex is weak or poorly timed, urine remains in the urethra. That is why pelvic floor training works. It strengthens and reconditions that reflex. Another often overlooked contributor is sitting posture during urination. Men who sit while urinating may experience less dribbling in some cases because the pelvic floor is more relaxed and supported. However, the trade-off is that if muscles are weak, sitting does not solve the underlying issue. Standing requires more active control. So the best approach is not changing position alone, but improving muscle coordination regardless of position. Now let's talk about something practical you can apply immediately. When you finish urinating, do not rush. Pause. Stay still. Let the system settle. Then gently contract your pelvic floor muscles once. Not aggressively. Not repeatedly. Just a controlled squeeze and release. Then wait another second. Then, if needed, use a gentle perineal forward press to clear remaining drops. Finally, only then adjust your clothing. This sequence alone can significantly reduce dribbling for many men within days. But long-term improvement comes from training. 3 sets of pelvic floor exercises daily, morning, afternoon, and evening, can gradually restore strength. Most men begin noticing improvement within 2 to 4 weeks, with more significant results over 6 to 8 weeks. Now let's address a psychological point that matters more than people admit. Many men start to anticipate dribbling. That anticipation creates tension. That tension affects relaxation during urination. And that actually worsens the coordination of the pelvic floor. So there is a cycle. Expectation leads to tension. Tension leads to incomplete emptying. Incomplete emptying leads to more dribbling. And the cycle reinforces itself. Breaking that cycle requires both physical and behavioral correction. Relaxation is part of treatment. Finally, let's be clear about when to seek medical evaluation. If this symptom is new, rapidly worsening, associated with pain, blood in urine, or significant changes in flow, it should not be ignored. If there is concern about prostate enlargement, such as benign prostatic hyperplasia or bladder emptying problems, a urologist can perform simple tests to assess function. But for most men, the reality is reassuring. Post-void dribbling is common, manageable, and often reversible with consistent technique and muscle retraining. It is not a sign of loss of masculinity. It is not a permanent flaw. It is simply a coordination issue between muscles, flow, and timing. And once you understand that system, you are no longer guessing. You are fixing. Because control is not about force. It is about coordination. And the urinary system, like any other system in the body, can be trained to work better when you know how it functions. If you want, I can also turn this into a viral YouTube script with hooks, pauses, and thumbnail text, or shorten it into a 10-minute high-impact version.